Hi everybody, my name is Nora. I'm the clinical manager here at German Vets, and my colleague Ilse is with me today. As some of you may have heard, German Vets has actually just become the very first fear-free certified clinic in the UAE, in the Middle East, and in this half of the world, really. So it's something that's been quite an adventure for us, something we're very proud about, and we truly believe that fear-free is the future of veterinary for all clinics. We realize that most of you as pet owners don't necessarily get to see what that looks like, and we talk about it a lot, but we really wanted to give all of our viewers and our clients an opportunity to see in and around the clinic and the little differences that a fear-free clinic has. So we're going to take you in right now. We're going to be walking backwards and it's also going to be during an actual clinical time here at the practice. So it's the evening, things might get busy. So please bear with us if we're jumping around a little bit or if we fall over everything while walking backwards, okay? So this is the front entrance here of the clinic. We're gonna go in and just see how our reception is set up from a fear-free point of view. So we primarily see cats and dogs here, and we need to cater for both of them as their own individual species and make sure that their needs are always looked after. So that starts when you come into the clinic. You'll find throughout this live, I'll probably talk more about cats, Ilse will talk more about dogs. So the first thing when you come into German Vets is that we do not allow cats to be on the ground. They feel quite vulnerable, especially if there happens to be any other animals around. So we have a couple places that are dedicated waiting spots for cats. If they must wait in reception, we always like them to go straight into their consult room with everything ready. But right here at the front desk, we have this just little shelf here, really simple. It's something that if you're working at another clinic can easily be put into place. It's literally an IKEA shelf, but the idea is that there's a non-slip little grip pad here that your cat carrier can go on, and you can actually stand if you are at reception and checking yourself in. You are physically then at a visual barrier for your cat, so they feel really safe, they can smell you, and you're keeping them protected from any, peering eyes or anything they don't want to see. When they're here too, we always encourage all cats to be covered with a Feliway infused blanket. So Feliway is an absolutely amazing cat artificial facial pheromone that helps promote feelings of safety, helps things feel a little bit familiar. So even though your cat is in the veterinary clinic in a carrier with that blanket over that's been infused with Feliway, they might just get a sense of feeling like, this is weird, but it's strangely familiar, so I feel a little bit more okay about it. If we don't have this space right in reception free, we do have this custom-made cat carrier tree, which is big and wide and a really lovely place if a cat does have to wait at reception. Right, I'm gonna hand it over to Ilse.
And then just from the doggy standpoint, so something that is awesome is you'll see there is non-slip, oops, I'm trying to angle it, non-slip flooring all the way through. So from outside, I don't think we showed outside, so even from outside all the way through to ensure that our canine patients have so they stable on the actual ground. We also have that to go into the waiting room, the waiting area, where similarly to for the cats, here we've got pre-sprayed little bandanas with Adaptil, which is also a pheromone, but it's a calming pheromone for dogs. So our clients are more than welcome to put that on. Sometimes reception will ask if they would like one. Again, also it's very rare that we get our patients to wait in the waiting area. We want to get them into the consult room as soon as possible. And then what's very cool is in terms of our merchandise, even our merchandise is fear-free orientated. So in terms of, so we've got these wonderful, really, really cool cat climbers and trees that we actually have, you guys will see later in the consult. And then in terms of when it comes to all our toys and all our feeding options, or rather bowls, so for example, we really encourage species specific enrichment. So we always have puzzle feeders, snuffle mats, all sorts of different Kongs, all of those things available to encourage our patient's welfare in the clinic and at home. So shall we head on over to Nora's favorite room?
Yes. This is the flagship room of the clinic, I think. So in the reception, just like one last point, is we always have classical music playing. There's been lots of studies that show that classical music or music that's been specifically made for cats and dogs can really, really help to decrease stress, anxiety. There's actually even one study that shows that animals who are anesthetized with classical music playing actually require a lower amount of anesthetic drugs, which is very cool. So we make sure to start that journey here at reception. There's always music playing at a low level, but it's just something that can really help for any patients waiting, and also for owners who are in any way stressed. They have a trip to the vet clinic, that's often a stressful experience. So we also do these things to keep the owners as stress-free as possible. So just off of reception, we have our first cat consult room. So we do have a little warning sign for everyone outside to start being really quiet because it's a kitty cat area. And then this room is, like I said, one of 2 cat exclusive consult rooms. We take the actual species specific consult room is probably one of the most serious things here. So we would absolutely never have a dog enter this room. We make sure that it is only cats, and the same goes for the dog consult rooms. So in this room, we have a nice bench where owners can wait. We like to always have a nurse present with the vet so that there can always be enough people to observe the animal, to help distract the animal, to give treats. The owners often need to communicate with the vet, and then it's the nurse's role to make the patient as happy as possible. Some of the ways we do that is we allow cats to come out and explore. There's a couple little hiding areas. So we know that cats in general enjoy feeling safe and hiding, and it's one of the pillars of cat ownership is to always provide a safe space. So we make sure we do that in the clinic as well. We have a bookshelf in the corner here, which has been custom made to have these 2 little cabanas, I want to say, for cats that have very fluffy blankets in it that are also pre-sprayed with Fellaway. And sometimes if we have a cat out walking around and they want to go sneak away in there, then that's absolutely fine with us. We will conduct the consult where the cat is happy. Behind me, we also have these little hidey hole boxes, which again, lots of cats like to come out and explore. So the idea is once the vet has communicated with the owner and gotten all the information they need and they have to proceed with the exam, if the cat has chosen to be in one of these boxes, that's great, that's perfect. We will use a little blanket, pop it over the top of the box, and do everything in there where the cat is actually hiding and feels safe and secure. And then often they will walk straight back into their carrier from that. So it's quite nice. We also have this room equipped, of course, with more Fellaway. We have a Fellaway diffuser in here all the time, and we also have extra Fellaway blankets. I've always found when consulting in this room, probably the favorite spot of cats to go to, and probably where 8 out of 10 cats have their vaccines when they're with us, is on our little window hammock. So it's just a great spot. It's very sunny here in Abu Dhabi, and cats just tend to really enjoy hopping up there. And if that's where they want to be, that's where we do the consult. We also have these little shelves that many cats like to go up. We have done consults on a ladder, examining cats at the very top there because that's where they want to be. We also do have a lovely rug in here, which is non-slip. So you'll hear us say non-slip a lot today. We make sure that all of our surfaces that pets will be on are non-slip. This is especially important for older or arthritic animals. If they're slipping around, if they're not able to get a grip, they can be quite uncomfortable, and that would, of course, then also add to their fear and anxiety. So we do have a consult table in this room. You'll notice in a minute we do not in the dog rooms. And the reason is, another thing we know about cats is that they tend to be quite happy and secure up high. So the consult tables are often a perfect place. It's a classic place to examine them, and they do often like it and prefer it. So we have lots of options for them. And definitely our scales, as well as I just mentioned non-slip, all of our scales have a non-slip surface on them. We have our little treat buffet. So probably one of the cornerstones of fear-free practice is always knowing our pets' preferences. We send questionnaires to our clients before they come in to find out everything we can about their pets. We make sure we know their favorite treats. We have it stocked. even if that means doing an Insta shop and getting a fresh chicken in. So whatever they want, we like to have. We want to make their first experience and every experience a happy and a positive one. So we really enjoy doing those things, and we enjoy reading the questionnaires of our clients and finding out more and more about the animals. It helps us not only to make an enjoyable experience, but for the vets and for the nurses, it actually allows us to do a better job as clinicians, because cats especially, maybe I'm wrong, maybe dogs equally, but cats very much so are known to hide, illness. They're so stoic, and they get into the veterinary clinic and their adrenaline goes up and they will do, what they need to do to survive. And sometimes if they're very stressed, it's almost impossible to find out what is really the core of the issue. So when they are relaxed, when they are happy, when they trust us, when they're eating, when it's a positive experience, we are much more likely to be able to get to the diagnosis we need, and much more likely to provide the treatment needed as well.
And that for your free questionnaire before, especially if it's a new client, so we have what we call an emotional medical record for every single patient that we have. And that prepares us, it prepares the team, so we know, okay, this cat or this dog, these are their favorite food. Oh wait, they're a little bit sensitive here. And we adapt our handling plan and everything that we do with bearing that in mind. So yes, definitely, snacks are
Life.
Our life.
Okay, so we'll head back out to reception. Like I said, it is actually a normal night here. So we do have consults going on. So right now we're going to be able to show you one of our two dog consult rooms. Hopefully later we might be able to show you the other one, but there is a doggy here right now and we're not going to disturb them. So I'm going to
feel free.
Yeah. I'm going to hand this back over to Ilse, and she's going to show you her favorite room of the clinic probably.
Yeah, definitely. One of my favorite rooms. Oh yes, and I just saw this, I forgot. So at reception, we also have these little scent boxes. So we actually have a scent library, so that I'm trying to tilt this. So when you are standing, you're so good at the angling with this. When you're standing, for example, waiting, and your dog might be a little bit, they always want to go over and sniff things. We actually have the perfect little spot to keep them occupied. That gets rotated quite frequently. We've got another spare one there, so if one of the receptionists sees that, for example, maybe you're standing that side, their fear, anxiety, and stress level increases, we have that nice little scent library out. Okay, and this is my favorite dog consult room because it's so big. I mean, they're all great. So this is our big dog consult room. We call it the big one because it is the largest consult room out of the two dog rooms. And what's great about this is we actually have, so we came in through the reception area. We actually have a completely separate entrance that comes from the back, and that goes down, as you can see, into the parking lot. So depending on, so for example, if we do have a patient that is perhaps a little bit more worried about that their fear, anxiety, and stress increases by coming into the actual veterinary clinic, we can take them around. So we have or if there are a couple of other, let's say there's a dog patient in the clinic or other feline patients, we can use a completely separate entrance so that the cats and dogs don't have to see each other. And what's cool with this room is, so even as we enter, so this is usually where the vets do all their prep stuff. We already have snacks for the vets to scent and introduce themselves. We've got some nice little toys for them to play. I don't think you get a sense of how big this room is. Yeah, there we go. And there's so much. I love this room. And then over here, so similar to what we have in the cat consult rooms, we've got our little designated kind of space for all our, so we've got one of our scent boxes here. We have very easy access to a variety of toys. So obviously we've got different, squeaky toys, roper toys, depending on what the dog enjoys. And again, we can see that from our questionnaire, so we can prepare. Then sometimes we also find that some dogs, especially if they don't, let's say they've got a very limited diet, like they can only have hypoallergenic or something like that, or it's restricted because they might go under sedation and we can't give them as many snacks as we would ideally want. Again, depending, so if they're not that into toys, they might really like a little brush, so we always have little brushes available for those dogs that actually enjoy that. And then, of course, from a safety standpoint, we have our variety of muzzles available. Obviously, a very big part of the muzzle is also owner education, and also for our staff to be trained with that. So really always pairing the muzzle with something good. And we've got, again, very specific, nice snacks for that. So we love the cat snacks. The dog people love the cat snacks to actually feed them through. And then over here, we have our little scent library that we keep stocking up with all sorts of different things. So I think there's some stuff, yeah, there's a horsey, some horse mouth, some hay. Down there are some herbs, there's some rocks that some people brought. So we just keep adding onto the library and we keep changing it around just to keep it also interesting for our patients. And then, of course, puzzle feeders. We also have the Adaptal. We have pre-spray blanket that we usually have already down here, and we pre-spray these as well if we need additional. And of course, again, all the snacks, so snack variety. What's important in this room also is we've got snacks in different spots. So we've got snacks on that side by where the vet comes in. We've got snacks over there, and we've got snacks in that corner. So no matter where you are able to, you know, roll, toss a reward away and, you know, maintain a lower FAS for that canine patient. Then we have what we also love a lot is our little magic carpet. So again, non-slip. So we actually, what we do is for those patients, especially those patients that are a little bit worried about a scale, we actually make a little magic carpet for them that just helps them get over the scale a little bit easier. We also, of course, where we can, you know, teach dogs about you know, following the treat and all of that. And Nora just reminded me, I'm so used to it, I don't even realize it. And guess what? There's no table. We absolutely have no tables in our dog consult rooms because we know dogs tend to shut down when they get lifted off the ground because they don't have control. So
I think it's a good point. Like, lots of people who have brought their dog to the vet before, and they might think, well, when they're up on the table, they accept everything. They just accept it. And it's something that, you know, the more and more research has shown, like, that it's not that they've accepted it or that they're okay with it. It is often that they have shut down, and that's not a state that we want to put our patients in, which is why we always see them on the floor.
Yeah, exactly. And on that, we also have a lot of information available for our clients. So for example, the fear, anxiety, and stress ladder. So that what Nora's talking about is the freeze response. So there's also, you know, there's a very big part of it, you know, we're a fear-free certified practice, but it goes beyond the practice, right? We want to give as much for our clients and patients as possible. We also always have classical music playing, and then a nice little air purifier, because, you know, apparently, you know, dogs can oh no, I'm just kidding. Anything else in this room that I missed potentially? I think so.
One other thing worth noting in here, so we have a separate room, which is just like a little storage room here. It's not super pretty, nothing too exciting. However, that is where we've chosen to keep our vaccine fridge, so that, let me see if I can get it. It's a little bit little.
It's a little bit.
The idea being the nurse, when they're drawing up vaccines, that noise alone of opening a syringe can be triggering for some pets. So we like to do that completely separately, have everything as prepared. That's a big part of practicing in the fear-free way anyways, is have everything prepared. If most pets have been to other, you know, clinics and had experiences, and those noises, those things that are familiar, can already start to elevate their fear and stress and anxiety. So we like to keep them separate and be prepared for everyone who comes in.
And Adaptal diffuser plug-in.
Oh yeah.
There's so much. There's just things. It's so like normal now. It's almost like,
I know. We're super fortunate too that our suppliers of Adaptil and Felloway, they actually help, they supply us with in-clinic use. So it's something that is so important to us that St. Vincent Group in Dubai really helped us out with that. And they send us every month the pheromones that we need to keep doing this for our patients, which is very cool.
Yeah,
right.
Shall we go
upstairs? So we are basically a 2-floor residential villa here that has transformed over the last 16 years into what we are now. There's a separate building in back, which we'll probably do a different live on. That's where our cat boarding is. So that would probably be too much for this evening. We have another cat consult room just here at the top of the stairs, but there is patients in there right now, so we're gonna walk right past there. You'll see outside the door, there's a very big quiet please sign that does light up, and the reason is upstairs is a clinical area, but we do have that one consult room, so we just want a constant reminder for everybody to use their indoor voices, which we'll start to do now. So
We get so excited.
I know. We have our just in-house laboratory here, which is pretty standard for most clinics. We have, non-slip, yes, thank you, Ilse. So non-slip, so we purposely have put the 2 dog consult rooms downstairs and the cat ones upstairs because we don't want dogs to have to walk up the stairs if they're not comfortable with that. However, sometimes they do need to come up. Sometimes dogs are prepared for surgery downstairs and then brought up on a stretcher, but occasionally they do have to come up, so we just make sure that the non-slip journey goes all the way to everywhere that they need to go.
Yeah.
And just through here it's actually our team room. And it is a good expression of how Fear Free isn't just for the pets, it's for the team too. It's something that's very important to us, is making sure that our entire team has a good balance every day that they're here, and they have a place to come and chill out and eat their food and close the door and relax for a few minutes. So we keep this room for our amazing team.
Yeah, and we've got our little gratitude wall.
Yes.
We say thanks to everyone,
Thanks to each other.
And thanks from the clients. So,
so
good vibes.
Only good vibes in here.
Yeah.
Right across, we have our dental room. And we have a very special vet here, Dr. Adrienne, who is essentially a pet dentist. She does some very, very cool restorative work, which is a little bit unusual in the veterinary industry. And she does everything from root canals to orthodontics. And because our dental machine is used so frequently, we need a separate space for it. So anybody in the industry will know that dental machines are very noisy, and that's something that for sure can be upsetting to animals who are not anesthetized. So we keep her over here in the corner of the clinic. It's a nice, quiet, relaxing room. So if a patient does need to be prepared for surgery in here when the machine's not on, they can be. They can also recover in here and never have to be near any other patients during their stay. So this is just really a fully equipped surgical room specifically.
Yeah, because as I walked in, I was like, this is very cool. So clearly someone was in here with a kitty cat at some stage. So instead of just having the kitty cat on the table, a little bed, little groom, little snacks, because that's what made that patient feel.
And this, I think specifically, so when we have a cat dental, when they are waking up from anesthesia and we take them off that table and we can move them, we want to make sure that they are warm, they're comfortable, and that they are waking up in a very pleasant way. So that may mean, and often means, that we have the owners present for both sedation before a procedure and also for recovery. We love when we're able to give to the patient the experience of having their owners be literally the last thing they see before an anesthetic and then the first thing they see when they wake up. It's very comforting. If we can't do that, then we want to make sure it's as positive as an experience as possible, which why we have a bed here and brushes, that if it's a cat and we can wake them up gently grooming them, that can be a very comforting experience for them instead of them waking up alone somewhere. We also just have some really, really nice windows in this room with lots of activity. So if we do have any patients that are here ahead or behind, they've got lots of distractions. Non-slip pad here in case we do have any doggos come up who...
Space for owners when they recover or...
Exactly. So it's a lovely... For dentals, which again, anybody in the industry knows dentals are not something you think about when you think about calm and relaxing, or pretty, nice, whatever. And we have tried to influence our dental procedures here in that way to make it as calm and lovely as possible. So we'll head next door to our cat hospital room. So kind of goes without saying, our hospital areas are completely separated by species as well. We would never ever have a cat and dog hospitalized in the same area. So we do have this cat consult room here. Sure, I'll go through the board maybe. Are you going?
Wait, no, let's actually go there.
Perfect.
Sorry, we're just going to do something else because we don't want to just, because as we said, it's a normal day, we don't want to disturb a little kitty cat.
Perfect. We'll just show you quickly our little inpatient board. We won't show you all the names on it. However, a couple of the things that we always take note of here is pain score. So it's super important to always be aware of the pain score for patients. We take it at least 3 times a day. The vet will prescribe if they need it taken more. The idea that it's here in a very centralized area is that if there is something wrong, if there is something that's going above what we're happy with pain-wise, it's right there to be addressed. It's, you know, where everybody can see it, and everybody in the clinical team does take ownership for addressing that. Next to the pain scoring, you'll see we actually have the fear, anxiety, and stress level. So that's something that we're constantly monitoring as well, and then reacting to as we need to. So if we see something is higher than it should, we always get involved and see how we can lower that. And there's so many ways. It's how they're kept in the hospital. Are they in the right room? Is it quiet enough? Do they have enough belongings from home? You know, is there anything that we can do to decrease their stress when they're here? Or is it a case that they need extra help, that they need, you know, some calming medications during their stay? There's so much that we can do to help them when they're here.
We of course have all the fear-free, well, you know, all the FAA, so when we do, just to, you know, help us cross-check, just to make sure, and we've got the pain score on that side as well. So it's all nice and lovely to have it, have it all in one place.
So this is also another very lovely room. This room that we're about to go into is like a surgical prep room. It's a dog specific room. If we do have dogs hospitalized, there's a separate area there. Maybe Ilse, I'll hand it to you to show everyone around.
Yeah. Oh. Alrighty. So again, we've got the non-slip surfaces, as you guys can see, and what this is like one of my, I think, favorite rooms now. Actually, come to think of it, because it just honestly feels, especially when you know, our patients after a surgery or procedure, it's just really lovely to actually have the owner with them on the couch and they're busy recovering. We've got, you know, our comfy bed. We've got lots of toys for them depending on what their preference is. We actually did a really lovely, one of the videos that we shared a while ago was this lovely, very fear-free blood draw that was really great in terms of, you know, the dogs can also look out. So some of our patients really love having a look outside, and it gets quite busy in terms of there's lots for them to look at. So that's a great space. You know, and then we also have, again, snacks. As always, we always have our little snacks and licky mats and all of that stuff, with the music also going in on the background. And then what is really, really great is, so this can be a nice recovery room. We've got extra yoga mats if we need it. And then on this side, shall I switch on this light? And then what's great is on this side, we've got separate, so this is especially for patients who have to be, you know, monitored, that are hospitalized. Like, you know, so we've got this really, really nice, you know, again, non-slip, it's very comfortable, got music going, diffusers going, and then we have this great little divider that we can use to divide all our patients. And what's great with these is they're completely mobile, so if we need to move it out, and I mean we kind of arrange it as need be per patient need. So if we've got, let's say, a hospitalized dog over here and we've got a dog recovering here, they can't see each other because of the music, you know, we really respect all the stimuli.
Can I add something?
Yes,
for dogs,
please do.
Even though I don't know that much about dogs.
Oh,
so
come on.
We made the choice when we were fitting these kennels to have less but have them really big than to have lots and have them small. So for a nurse, it's amazing. These kennels are actually so big
they are.
that you can be completely inside them with the patient. So if we have to do a catheter change, if we have to do a blood draw, we can be in here. We can be in here with the owner and the pet. We can sit and relax
And you
with
can
them.
close
And
this as well.
And we often have a buddy system here. So we have some amazing team members that help us, where if we do have a canine patient who is a little bit lonely and they just want that human contact, it's plenty big enough. I mean, Ilse's often in here doing her work with her laptop inside here with the patient, if that's something that they need.
Yep, exactly. So, yeah, and then of course, computer and all that stuff.
Yeah.
And
I can take through an office.
yeah. And then Nora's going to do ops.
Yeah,
I love this room. This is just like, and even the color.
It's very
I know,
peaceful.
It's so peaceful. It is just honestly.
We have lots and lots of treats, everything from the other rooms. I don't know if you mentioned that, but everything that we have, we've got scent,
And scents.
everything.
We got little scent bags.
Yeah.
Distraction. Yeah.
So it's
Amazing.
just, we're fully equipped all the time. We like to have everything at arm's length. And then right off of this room is our...
Should I just do this?
Yeah, that works. Is actually our main surgery room. So this is where we do soft tissue. If we're doing any orthopedics in here, this is where we've done a couple brain surgeries as well. And this is just our operating theater. So this is a very clean, minimal room, but the great thing is we have these glass doors, so if the vet who's on duty is operating, that they're able to quickly communicate with the team outside. So there's not a whole lot to see in here, except for the idea that it is right next to this prep room. So you can imagine if you've had a dog who's had surgery before, how lovely it would be for them to be able to fall asleep here with you, and for you to literally be waiting on the couch when they come through. It's right next to each other, so that's quite nice.
So we go to the
Hospital?
cat hospital.
I'm gonna do my, yeah.
And this is also so how we, so just to show you guys. So earlier we wanted to come here, but we actually went the other way, is because we have this little slit here, so we can always see what is happening inside. So I had a look and I saw, okay, they were actually, busy with a little kitty cat, didn't want to disturb. So all of this is towards fear-free. It's not just because it's glass and it looks pretty.
Okay, let me show you around the cat hospital. So, sorry, I'll take it for a sec. So, we have two main cat hospitalized areas. So this is our main suite. We also have an isolation area. So this room here is for cats that have something, the reason for being with us, and it's non-infectious. So day patients would be here, surgery patients, and just in hospital patients as well. We pay really special attention to their needs. So besides being a fear-free certified practice, we are also a gold standard cat-friendly clinic, and we pay very special attention to cats' needs while they're here with us. So we have just their little shelving area with everything a hospitalized cat could need, and the different elements, I suppose, that make it a little bit different to the average clinic is that we always have very, very thick bedding. We're constantly aware of, if we have patients that are uncomfortable in any way, and we make sure that they have non-slip pad and then thick bedding like this vet bed. We also have little scratchy pads available. So these little cardboard ones, scratching is such an important behavior for cats. It helps them to leave little pheromones that helps them to feel safe and secure. It's a natural instinct of theirs, and we like to be able to provide them an outlet for that when they're here in hospital. So if we have any long-term hospitalized patients, we have those available. We of course have lots of toys, brushes, catnip, treats. We also like to communicate with each other as a team. We'll put on their hospital sheets. The patient down at the bottom will say, I love puree, I love being brushed, I love being left alone. Whatever the preferences that we're learning during their stay, we're constantly sharing those so that every day can be better for the patients. For our bowls, we know that cats prefer to have ceramic or glass bowls typically. So we don't have metal bowls that have reflections and can be a little bit upsetting for cats. We don't have plastic bowls, which often can have a bit of a taste after, a long bit of wear and tear. So we use ceramic. We like flat dishes or very wide brim dishes. And that's because most cats don't like when their little whiskers touch the edge of that. So we're thinking of all of those things constantly. Yeah, lots of treats, lots of enrichment feeders. So we love to feed cats with things like ice cube trays and licky mats. And the reason is we like to keep them mentally stimulated when they're here. It's something that is important for cats to be able to act out their predatory nature. They really enjoy having to work for their food. And when it is medically suitable, we love to feed cats like that here. We have some hospital units here. We do have some patients, so I won't get too close, but basically each unit has 3 compartments. So they have a private compartment there where their litter tray often is. If it's a big cat and they need more space, it goes next door. And then they have a little shelf they jump up onto, and then a little private bedroom up inside as well. And if they are on IV fluids, the IV fluid giving set can literally reach anywhere in it. Something else I just saw that's just a very GVC thing is we just kind of have planted everywhere in the clinic little things like this that are just like reminders. So that's our hospital room standards. And it doesn't list things like disinfectant is a must. It is, and that is important. But it says things like, please use inside voices. Music is always playing. Use bedding from the cat's home if it's available. Shield cats from other cats. So those sort of things that we're just constantly reminding each other of is quite nice. When we do have to examine a cat here, if it's not suitable to do it in the kennel, we have our little examination space. So if a kitty cat staying with us has to get their blood taken, if they need a new IV catheter placed, that is where we will do it. And we make sure that we use one of these vision protecting screens as well. And we like to do it here by the window so that they can actually look out and see what's going on in Khalifa City. And we do have a little ground area too. So the odd time we do get a cat who comes in and is very comfortable on the ground, we have non-slip there with a blanket over it, of course. And we like to, again, just like with the cat consult room I showed you, do it where the cat's most comfortable. That's why we also have a hammock in this room. Treats on hand for blood jaws. It's probably the most important instrument for any little clinical procedure that we're doing here is lots and lots of treats. And yeah, I think maybe we can start to head back down. I think see if there's anything we missed on the way. Not sure, is there any other space that you want to show everyone?
We can see if the other doggy consult is open. I think that's
Perfect.
the only other one. So there's, as we said, 2 cat consults, 2 dog consults. If it is, I don't know.
Yes. Perfect. Okay, so we'll see how we go walking backwards down the stairs. And unfortunately, the other cat consult room is actually still occupied, so that one we won't be able to do. Oh, isolation. So very quickly before we head back downstairs, this is our other cat hospital area. This is feline isolation. So it's perhaps not as super pretty and homely as our cat hospital. Because it is isolation, we want to keep things very minimal in here, very easy to clean. However, we do have the same standards everywhere else. We make sure to have pain scales everywhere available, FAS scales, fear, anxiety, and stress scales. And we also always have music playing. We have, of course, a privacy screen. And this area of isolation is normally used for low-risk cases, things like unknown vaccine status, very sick cats, cats who have, let's say, panleukopenia or cat flu, go through those 2 double glass doors into another segregated area. When they're there, though, they always get the same as everybody else. So they always get lots of treats if it's suitable for them medically. They always get, things from home, cardboard boxes to hide in. All the same applies for our cats who are in isolation. If anything, it's even more important for them. We also have our little examination area. And again, lots and lots of treats and catnip and everything.
Yeah.
So, will we go down and see if this other doggy room is free? I think what's worth noting is even though these physical things are quite unique to a fear-free clinic, for us, the most important thing is actually the organization, the team training, how we communicate, getting all that information. We like to give minimum 20-minute consults for all of our patients. But if it's somebody who's nervous, if it's somebody who hasn't been here before and needs to get to know us, it's 30 or 40 minutes, and that's just standard. We don't charge extra for that. That's just something that's really important for us to be able to create that positive relationship with our patients. Right, here you go.
And then the little doggy room. So this is for kind of our smaller dogs, I guess, and sometimes puppies. And very similar, you know, same standard as what we have in the other dog consult room. So what I love about this is we also have little hangings on this side, just because there's purely a little bit less surface area, i.e. in terms of like tables and that kind of stuff. We've got these little baskets where we can just quickly grab some snacks as we come in. Again, no table, no examination table, and of course also, you know, the scale, which is, again, we can just grab our yoga mat and make our little magic carpet. And then, of course, referring to the FAS stuff. I don't know how Nora does it. She's like a pro. And then what I really love about this is that there is a little bit of, so this section is a little bit wider for the patient. So over here we've got everything that we'll need so that we don't have to interfere in, you know, get too much into the dog space. Again, we've got our lovely little scent box. We've got our brushes and this is where the other one is, our brushes and our muzzles and things there, music going, snuffle mats, also toys, lots of snacks, so a big variety of snacks. We've got a little space there for the client to sit and wait with, non-slip surfaces. Adaptal, the adaptal, I almost said fell away, the adaptal diffuser, and yeah, it is just so lovely to be able to have, to have. What's also great is that we communicate a lot with reception, so that you know, we'll always check, is it kind of safe, I guess. So we kind of like sometimes, you know, is it safe to bring the dog out, safe in the sense of, are there other dogs, are there other patients? If it needs to be, do we actually take the invoice and the card machine and we make payment in the room, or actually, like today, at the actual car, for example. So it really is about just, I just think it's kind of in every inch of the place and the people.
It's like a way of life almost for a veterinary clinic who embraces it, and it's something that I couldn't recommend more highly to other veterinary professionals. There's a individual certification process that anybody can do no matter what clinic you work at. It is so valuable to have that information, and you see if it's not an area you've done before. As soon as you start applying these techniques, as soon as you start understanding a little bit more about fear, stress, anxiety with our patients, and how much better, you know, of a clinician you can be when you're able to alleviate those things somewhat, it really changes the game, and it just makes the veterinary profession even more rewarding. It's something that I truly believe will be the way forward for all clinics in the future, and I would really recommend anybody in the industry to go this way. And for pet owners, really, I think, you know, once you've experienced a fear-free consult, once you've experienced that, you can really see the difference, and you know that is what your pet deserves.
Yeah. So thank you guys. Thank you for joining us.
There's also a podcast out today if you want to hear more about the process.
Yeah.
So
it's the pet behavior the pet behavior chat. Oh my goodness, the pet behavior community is the Facebook page. The pet behavior chat. You can go onto Spotify or Apple Podcasts. Just look for that. So it's the pet behavior chat with Dr. Katrin. And we actually, the episode came out today where we talk about a little bit more in depth about this process. And thank you so much for joining us to have a little bit of a peek to see a walk around of what it is to be a fear-free certified practice.
I think we're going to do some fear-free snippet lives coming soon as well, so we can speak to some of the vets. Maybe we can see some stuff in action. So we'll let you know when we're doing those. But
amazing.
Bye for now.
Bye for now.